Gestational diabetes and its link to autism and neurodevelopmental disorders in children, shocking statistics and what you need to know. April 7, 2025, Reuters. A recent large-scale study has raised alarms about the effects of gestational diabetes on children's brain development. The study provides more evidence that gestational diabetes can increase the risk of neurodevelopmental disorders in children, including autism, ADHD, and intellectual disabilities. Experts warn that the rising rates of gestational diabetes in the U.S. are a growing concern, and the link between this condition and brain development in children cannot be ignored. Gestational diabetes and the increased risk of autism and neurodevelopmental disorders. A meta-analysis published recently, which analyzed data from 202 previous studies involving over 56 million mother-child pairs, revealed that children of mothers with gestational diabetes are 28% more likely to develop neurodevelopmental disorders compared to children whose mothers did not have diabetes during pregnancy. Specifically, autism, 25% higher risk. ADHD, attention deficit hyperactivity disorder, 30% higher risk. Intellectual disabilities, 32% higher risk. Communication, movement, and learning problems were also found to be 16% to 20% higher in these children. Pre-pregnancy diabetes, a greater risk. What is particularly concerning is that mothers who had diabetes before pregnancy, type 1 or type 2, are at a 39% higher risk of having children with neurodevelopmental disorders compared to mothers who develop gestational diabetes, diabetes that only occurs during pregnancy and typically resolves after childbirth. This suggests that both genetic and environmental factors during pregnancy play a significant role in a child's brain development. The growing concern of gestational diabetes in the U.S. According to the Centers for Disease Control and Prevention, CDC, gestational diabetes currently affects 9% of pregnancies in the U.S., and the rate is on the rise. This trend highlights the urgent need for proper management of diabetes during pregnancy, as it not only affects the mother's health but also significantly impacts the child's brain development. Experts caution, the link needs more clarification. While the findings of this study provide important insights, Dr. Magdalena Janecka, an expert at NYU Grossman School of Medicine who studies prenatal exposures and child development, emphasized that meta-analyses like this one cannot prove cause and effect. She explained, meta-analyses help us compare groups more accurately, but they don't bring us closer to understanding the underlying causes or mechanisms of these issues. However, she also acknowledged that the association between gestational diabetes and neurodevelopmental disorders, especially autism, is well established. This highlights the importance of medical monitoring for pregnant women at risk of diabetes and continuous tracking of their children's development. Previous studies, genetics and family factors may play a role. It's worth noting that 7 earlier studies comparing affected children with their siblings found no clear impact from maternal diabetes, suggesting that genetic and family environmental factors could contribute to the increased risk of neurodevelopmental disorders. While this is an important consideration, experts agree that health monitoring for pregnant women and child development tracking are essential to reduce the potential risks. What can be done? The importance of ongoing healthcare support. The study emphasizes the need for continuous medical care for pregnant women at risk of developing gestational diabetes. Pregnant women should follow regular health check UPS, maintain a healthy diet, and adhere to medical guidance to protect both their health and the health of their child. Moreover, it is crucial to monitor children's development after birth, especially for those at higher risk of developing neurodevelopmental disorders. Pediatricians recommend regular health screenings for children to detect early developmental issues, allowing for timely intervention. Action is critical. While this study adds important data to our understanding of the link between gestational diabetes and neurodevelopmental disorders, it is clear that diabetes management during pregnancy is key to reducing the risk of developmental issues in children. If you or someone you know is pregnant and at risk for diabetes, it is crucial to take proactive steps to manage the condition and ensure both mother and child are monitored closely. Don't overlook this information. If you found this article helpful, share it with your friends and family so more people can learn about the risks associated with gestational diabetes and how to effectively prevent them. This version is tailored for an American audience, keeping the language clear and straightforward while emphasizing the importance of action and awareness surrounding gestational diabetes and its impact on child development.